Hello and welcome to this webinar on mental health. My name is Hendry and I'm the Director General of the CLA, the Country Land and Business Association. The CLA's purpose is to champion, protect and enhance our rural economy, environment and way of life. We tend to focus on the political, economic and policy factors that impact on those things, but the health and well-being of rural communities is also at the heart of this. Mental health is an important subject for rural communities at all times, but it couldn't be more topical and urgent at the present time. If feelings of isolation and uncertainty and financial worries are among the top factors affecting people's mental well-being, then the conjunction of coronavirus and the changes brought about by Brexit must make this a very risky time indeed. I know from talking to CLA's advisors that some members are feeling very alone. And when they ring up, they can be on the phone for up to an hour at a time. So keen are some people for someone to talk to. I hope that today's discussion will help demystify what can still be very hard to understand and deal with for the majority of people, despite the much greater public discussion and awareness of mental health in the last few years. Our panel of experts will help you think about the causes of poor mental health, the signs to look out for, and the practical things you can do, whether for your family, your business, or your community. So let me introduce our speakers. Today's webinar is brought to you in association with CLA Healthcare, and our first speaker will be Richard Gould, who is a director at CLA Healthcare. We also have Hazel Craig, who is the Senior Data Analytics and Wellbeing Consultant at CLA Healthcare. And our third panellist is Dr. John Burke, who is the Medical Director, Healthcare Management at Burke Global and UK Insurance. And between them all, they have very many years of experience to share with us. So thank you very much. I hope you enjoy it. And I'm now going to hand over to Richard Gould to kick us off with an introduction. Thank you, Richard.
Thank you very much, Sarah. And hello, everyone. My name's Richard Gould. I'm a director at CLA Healthcare, and I'm extremely excited to be given the opportunity to support CLA today on this mental health webinar. Firstly, I just wanted to take this opportunity to introduce CLA Healthcare, especially to those members who don't know who we are or haven't yet had a chance to engage with us. We're extremely proud to be a trusted, long-standing partner of CLA and have been working with members for more than 12 years now, currently managing the medical insurance arrangements for over 1,000 members. We're completely independent and impartial and provide advice on all aspects of healthcare, wellbeing and employee benefits. Providing exceptional client service underpins all that we do. So CLA members have access to a dedicated team with over 50 years collective experience in supporting both individual and business members with a range of products and services, whether that's private medical, dental and medical travel insurance for individuals, or group life, income protection and key person insurance for businesses. And last year we managed to save members an average of 26% on their medical insurance premiums. Today's webinar is about raising awareness and focusing on mental health in the rural sector, and to highlight CLA and CLA Healthcare's recognition of this subject and commitment to support members. A growing national focus on mental health, spearheaded by the Young Royals and high-profile public figures, is helping to make discussion more commonplace and is certainly helping to shake off the stigma. Set against the backdrop of World Mental Health Day, which took place on the 10th of October, and the work already undertaken by CLA Healthcare to raise awareness of this subject, it's time for us to collectively focus further on mental health and outline some steps that CLA members can take to proactively support their own, their families, and their employees' mental well-being. The workforce is definitely changing. We now have multi-generational workforces with different financial priorities between the young and the old, which challenges employers. COVID-19 has added additional pressures on the NHS, leaving health bosses fearing that waiting lists could double to more than 10 million by the end of 2020. These pressures mean employers are considering alternative ways of giving their staff access to healthcare support. Things such as mental health apps, virtual GPs and health cash plans are increasing in demand. And I'm proud to say this last 3 years, we've been able to innovate the range of services we offer members, adapting them to reflect this changing healthcare landscape, but more importantly, the needs of CLA members. There's been a reinvention of healthcare delivery. Products themselves have had to change. As an example, services such as virtual GPs are now a common feature of most medical insurance policies compared to 5 years ago. We also know from our own experience that in the past, mental health services were often taken out of medical insurance policies as a way of reducing the overall cost of cover. But more recently, we're actively seeing members asking for this level of cover to be reinstated or included within their healthcare for the first time, as they recognise the value that this level of professional support can bring. We know from our conversations with members that stigma around mental health being is starting to change. Members recognise that physical and mental health are inextricably linked and both need to be proactively looked after. And at CLA Healthcare, we are committed to providing members with guidance and support on this very subject. Well, I think that's enough from me. So without further ado, I'd like to pass you over to my colleague, Hazel Craig, who is one of our senior data analytics and wellbeing consultants. And she's going to talk to you more about mental health within rural communities. Over to you, Hazel.
Thank you, Richard. So I'm going to be discussing health and wellbeing within rural communities today. I'm going to start by giving you a bit of an overview of mental health within the sector before moving on to talk a bit about stress and pressure, the difference between the two, before finishing off with some of the causes of stress and how you might be able to spot the signs within yourself and others before things become too challenging. So you really don't need me to tell you that the rural industry can be one of the most personally rewarding industries to work in, with many describing it as a lifestyle more than a job. However, it can also be one of the most challenging when you start to consider how risky, how volatile, and at times how isolating it can be. For example, rural businesses and workers are constantly dealing with issues that are beyond their control, such as changes in market prices, extreme weather conditions, reduced succession plans as younger generations start to move away from the rural life, things like Brexit. And this doesn't even start to take into account the other elements, like the extremely long days that can come with living in a rural community and the work that's associated with that, or the additional pressures outside of it, things like family and social life. Further, whilst it's well known that the rural community is renowned for their attention they give to their land, their livestock, to their crops, to their machinery, the pressures associated with living in a rural community, such as the lack of time or the lack of access or reduced access to healthcare services, can result in a poorer track record when it comes to taking care of their own health and well-being. So having a look at some of these stats on the slides in front of you, according to a recent poll by the Farm Safety Foundation, 81% of young farmers believe that mental ill health is the biggest problem faced by farmers today. And 92% believe that promoting good mental health is crucial in the battle to keep farmers safe and save lives. In support of these statistics is some research released by the ONS that found more than one member of the farming community dies through suicide every week in the UK. And the risk of suicide is highest among these workers, almost twice the national average. There's a lot of articles out there at the moment that are suggesting the levels of depression and suicide within the industry are rising. And so today I wanted to explore some of the risks that might come or might happen with regards to mental health, as well as discuss how you might be able to spot the signs. So, leading on from those stats, I wanted to talk to you a little bit about pressure and stress, the difference between the two, and how an imbalance in these and the sustained feeling of stress can lead on to things like anxiety, depression, and other mental health issues. So before discussing the graph though, I wanted to just talk a little bit about that difference between pressure and stress. So pressure is being defined as a thing that we feel when something is important to us. So let's say that we have a target that we're trying to meet, or we have a set number of orders that we're trying to complete. And this thing that's really important to us is basically dependent on us performing. That's how we define pressure. Now, stress is slightly different. So the Mental Health Foundation defines stress as our body's response to pressures. And we can kind of break this down into two factors. So stress is basically a combination of the situations or events that can put added pressure on us, so times where we have a lot to think about or a lot to do, as well as our reaction to being placed under that added pressure. So when we start to feel things are becoming too difficult or start to finding it more challenging to cope. That's the definition of stress. Keeping that in mind, or keeping those two things in mind, let's now look at the curve on the slide, which is commonly known as the performance pressure curve. Along the x-axis at the bottom there, you have the levels of pressure increasing as we head towards the right-hand side. And on the y-axis there, you have increased levels of performance as you head towards the top of the slide. And what this is showing is that whilst pressure can be normal, and it can sometimes be really helpful for us performing because we see our performance as important and we have some invested interest in the outcome of our performance. If that pressure starts to mount due to, say, lack of time or lack of resources, and that can be both internal and external to the situation or the work situation, we may start to become subject to stress rather than pressure. So we'll start to move into sort of that right-hand side of that curve where you're starting to see stressed and frazzled and burnout. Now, I also don't suggest going out and trying to use this as a way to improve performance among co-workers or people who might work for you. I do think it's helpful in being able to understand and identify when that normal feeling of pressure is starting to spill over into that negative and more unhelpful feeling of stress. And I think it's helpful to identify that within yourself, but also be able to identify that within others. So as a bit of an example, let's just say that you're up at 6, you need to feed the livestock, milk the cows, muck out the sheds, all before you even get the opportunity to turn off your alarm. And then before you can even leave the house, your partner's woken up and is feeling really unwell. They're asking for your support. I mean, you're supporting as much as you can, but you know that this is delaying your day. At that time, you're thinking, manageable, I'll make up the 5 minutes at a later time. That's fine, bit of pressure, that's good. So you head out to work, and after dealing with the livestock and the cattle, you head back into the house for a 10-minute breakfast. The 10 minutes you usually have is now reduced to 5 minutes after supporting your partner earlier. But remember, your partner's unwell, so it's also now your responsibility to wake the kids, get them dressed, and get them ready for school. That means breakfast is out the window, breakfast is skipped. The situation's now becoming somewhat less manageable. So you're ready to head back out and go on with your day, head out to machinery, start doing reviews of the machinery, start doing repairs on machinery. But before you even make it out the door, you've got a knock on the door, and it's a milk inspector who's turning up to look at your milk stocks. And now you're very much pulled in two different directions. And you're starting to feel that pressure in having to deliver both, or both of those elements with limited time. And that pressure is starting to feel a bit more like stress at this point. And then that afternoon, as you're doing a drive, you hear on the radio there's a new virus that's spreading across the globe with entire countries going into lockdown, throwing into question your ability to get workers on the farm, Your demand for milk might be reduced if cafes and restaurants are closing, and it's calling into question your ability to get people into that new cottage or that new B&B that you've just refurbished to try and diversify your income streams. This is now starting to feel a lot like stress and a lot like long-term stress rather than helpful pressure. Now, whilst stress isn't a psychiatric diagnosis, it is closely linked to your mental health in two ways. The first is that stress can cause mental health problems. And the second is that if you are suffering or if you currently have a mental health concern, it can make that problem worse. So let's talk a little bit about some of the causes of stress. But before jumping into that, I do want to try and caveat this with the fact that what contributes to stress and or anxiety and or mental health can vary hugely from person to person based on things like our circumstances, our personal circumstances, and our environment. So what might be a stressor for you perhaps might not be a stressor for me. And my experience of good or poor mental health may be very different to your experience of poor or good mental health. And I think this is really important to recognise, particularly when we talk about stigma in a few slides' time. So some common features of things that can make us feel stressed include dealing with issues that are beyond our control, things that can cause feelings of uncertainty about outcomes in the future. For example, and I think I touched on a few of these before, but things like extreme weather, market prices, disease, Brexit. And now, whilst this feature and actually the next features that I'm about to talk to have always existed for the rural community, an event like COVID can further exacerbate these stresses, creating further uncertainty, further financial pressures, and further isolation. So a second cause of stress you can see on the slide there is financial pressures, particularly when there's probably many of you already considering ways in which you can diversify your income streams, as I was talking about before, from say farming to farm stores or to B&Bs. And now that COVID's happened, it's throwing in the, supply of those customers into question. Another cause of stress at the moment, and particularly with COVID, is isolation. And not just isolation in the social sense, but digital isolation as well. So being in rural communities can sometimes mean that you have a lack of reception, or you have a lack of internet connection, or that internet connection maybe isn't as good as it could be. And that can lead to feelings of further isolation, particularly when the social element's removed at the moment due to social distancing and COVID lockdown. Along the same lines as that is the reduced access to healthcare through being further away from healthcare facilities, but also having reduced access to things like online GPs. I think as well, the feeling of the need to perhaps prioritise work over healthcare can sometimes also lead to further stresses when you are facing, a 12 to 15 hour day with work that can't be left until tomorrow, and you feel that you need to really prioritise that work rather than looking after or taking care of your own healthcare. And that can become a real challenge and add further stress to how you're already feeling. Now, I'm not saying that these are the only features of stress or the only causes of stress. There are many others, and I would challenge you to go away after watching this and really have a think about what might be some of the causes of your stress. Try to have a think what they might be and understand what those might be. So now that we've sort of looked at some of the causes of stress, let's think about what some of the signs might be. And these might be signs that arise in you, or they might be signs that you notice in somebody else, whether that be a family member or a co-worker or a friend. And again, I want to caveat this section before we go too much further into it and just say that, mental health is something that we all have. It exists on a continuum, and it ranges from good or positive mental well-being, where we're coping with the everyday stresses, through to poor mental health or well-being, where we're starting to struggle, with things perhaps like low mood or feeling stressed, through to mental health problems, where the symptoms are starting to impact our everyday living. And people can move up and down this continuum within their normal personal range in response to different daily or life stresses. So spotting 1 or 2 or 3 of these signs within yourself or others does not always mean, or does not necessarily mean, that there's an underlying mental health problem. However, what it might mean is that it's an appropriate time to check in on your own or your employees or your families or your friends' well-being, and consider what resources might be available for yourself or others out there. So what are some of the signs that might arise? Well, the Mental Health Foundation breaks this into 4 separate areas: mood, work performance, physical, and social. So under mood, we have things like higher irritability or sensitivity, and that kind of can come in combination with, lower emotional control. Perhaps you'll feel anxious, have a low mood, you have feelings of worry, things like that. If we think about the physical, that could come as, problems sleeping, which results in tiredness, or racing thoughts, nervous habits, so the panic sort of starting to creep in a little bit. You might have consistent sickness, so consistently run down, have consistent colds, or you might have a feeling of sickness inside you in your stomach. You might be feeling tearful, again, that sort of lower emotional control might be coming out. And now if we move on to work performance, that can look like things like, lower attention or lower concentration, which can lead to increased mistakes. Could look like being late or increased absenteeism, or people having difficulty making decisions, or you having difficulty making decisions. So the social and the lifestyle aspects, that could look like, withdrawal, avoidance, increased smoking and drinking, or drinking, should I say, changes in exercise and nutrition, so exercising less, or perhaps eating more, or perhaps eating less. But the thing I will say about this slide is that you're really looking for a change of behaviour within yourself or others. So, if you never really used to exercise and you're not exercising now, that's not necessarily an issue. You really are looking for a change in that sort of natural behaviour. So, as I mentioned throughout, this presentation, the way we experience stress and/or mental health can very much vary from person to person. Further, mental health concerns are really common. They are common. According to the mental health charity Mind, 1 in 6 of us will experience a common mental health problem like anxiety or stress every week. And this is what we need to remember when considering the stigma that can surround mental health. It's well researched that stigma and discrimination can really negatively impact somebody's mental health and can actually delay or create barriers to someone seeking support and/or treatment. And whilst there are national campaigns out there at the moment, things like Heads Together and Time to Change, that are aimed at reducing stigma, it is also really important to consider what we can do on an individual level. So what we can do for ourselves, but also others to help reduce that stigma. Some quick points on avoiding the stigma trap. The first is consider your language. I think it's fair to say that all of us have grown up in an environment where language like "you're crazy" or "you're a psycho" have been flippantly used, yet can be really damaging and contribute to stigma, and contribute to the feeling that someone is acting in a way that they shouldn't be, or worse, they can sort of contribute to this feeling that I'm now defined by that word psycho or that word crazy. So don't perpetuate the situation. Be conscious in your conversations with others, but also with yourself. Secondly, openly listen to others who may be struggling without being flippant or dismissive of how you or someone else might be feeling. There's a common saying in Australia, which is where I originally come from, which I've heard many times throughout my lifetime, and it goes something along the lines of, "Oh, you'll be right, mate," which basically means go on, get on with it, you'll be fine. I don't really have time to discuss this with you. And again, using this within the context of mental health can perpetuate the stigma around mental health and further contribute to the idea or feeling of, you know, I should be fine, my feelings aren't valid. So really do try and arm yourself with some resources, understand what resources are out there so that you know how to access relevant resources and you can confidently signpost others to those resources should they approach you. And thirdly, challenge and empower. Educate yourself and others. Challenge myths, challenge your stereotypes, empower others to share their mental health story with you, or challenge yourself to share your own. The research suggests that one of the best ways to tackle stigma is to talk or interact with someone with a mental health issue or who has had a mental health concern in the past. And I think this is very true. So just before I pass back over to John, I wanted to share with you one of the most powerful and, to be quite frank, helpful things that I've experienced in a long time. And that was an event that was put on by my organisation at the time, where two members of our senior leadership stood up in front of an audience of colleagues and peers and openly and very, very honestly discussed their own experience of mental health. That session's really stuck with me, and I often reflect on it and really do thank those people for helping to tackle the stigma in the way that they did and with such confidence. So I would really challenge you now to think about how you can tackle stigma, think about what you can do to try and make that change. Thank you very much. And now I'm going to pass over to Dr. John Burke, who's going to talk about mental health in the rural sector. Thank you.
Thank you very much, Hazel. That was a really good overview, including your clinical insights. So very, very impressive, I must say. So it's great to be here today, and I'm going to talk a little bit further around mental health, of course, in the rural sector, including how it poses challenges in this COVID era, as referred to earlier on by Sarah and also by Richard. So at Bupa, we've seen many, many challenges in the past 9 months or so of the pandemic, now that we're approaching the end of 2020. And with vaccinations for COVID-19 on the horizon, one might think that things are looking up, which they are. At the same time, people are saying to us that they are expressing some fears and anxiety about even life after lockdown and as vaccinations are being rolled out. Looking to sort of the family aspects that Hazel was talking about, there have been many, many impacts in this past 9 months and even further back on children and young adults, especially in the rural sector where people are very busy. There could be sort of working isolation problems as well. Sometimes people can even feel suicidal and have those issues that families can face around drug and alcohol problems. So my view is that nobody is particularly immune from this, that we need to be open, as Hazel was saying, demystify, as Sarah was saying, what mental health is all about, and be sort of mindful of our language as we speak about mental health. So it touches on a change in the conversation, of course. You know, we can have simple and supportive conversations around things such as bereavement, grief, and the health anxieties that I was referring to a short while ago. It's best not to delay in getting support. Support can be something very, very simple, like having a chat or reaching out to one's GP. And we at Bupa have services as well, of course, more of those in our questions and answers. So Bupa has experience, of course, for many, many decades in helping people to manage mental health. And this year we've looked at a report of around 3,500 workers, employees. The survey was done with the Prince's Responsible Business Network. Just to share with you here that 41% of employees experienced poor mental health caused by work, they felt, and that was an increase this year compared to last year, 41% as opposed to 39% last year. And again, a rise in the past year in that survey around mental health due to causes outside of work, with 1/3 of people listing COVID-19 as a cause of their symptoms. Mental health does touch on work and vice versa. 51% of employees cited that it was due to pressure. 54% of women are more likely to list pressure as a key factor compared to a slightly lower percentage of men. 35% of them responded saying that due to workload, long hours and lack of annual leave, that they were experiencing mental health problems. Thankfully, in the modern era, there's an increasing sense that we can speak about mental health problems. There's more support and then a willingness to talk amongst ourselves. 56% of employees in the survey felt more comfortable talking about mental health in the workplace. That was great to see a rise from last year, 51%. 76% of employees felt colleagues and 69% of line managers that they were being considerate of mental health well-being. 63% of employees who told their employer about a mental health concern had a positive outcome. Now these trends are applicable to the rural sector, whether one is in property management or small medium enterprise or in the farming sector, country sports and leisure. We feel that. An increasing number of employees are not talking to anyone, however. Sometimes people just hold back. And this slide on the right here, you'll see that that's a bit more of a trend, unfortunately, with men. 35% of men have kept mental health symptoms to themselves versus 26% of women. So what sort of practical support is available? Well, if one has a business, then there are wellbeing benefits programs that can be set up. At the same time, we need to know that, well, what's the normal here? Should we talk about social norms and how to reinstill those new norms as we're working all differently? Then I think that's the case. It's important, as Hazel was referring to have some downtime, to have those breaks in the morning, having sort of felt the family pressures of the day, to have time for oneself, and then to be more energized to help other people. And enhanced mental health support is available, whether by Bupa or, for example, via the NHS. And thankfully, due to destigmatizing of mental health, then we look forward to a brighter future for mental health in the UK. Indeed, at Bupa, we feel it's pretty much a mental health revolution over the past year. There's more openness, propelling us faster towards being in a better place, linking clearly active bodies and active minds with mental health. There's a feeling of connectedness, and as Richard was saying, it's almost a reinvention of mental health and other services, because now one can go online and use those services, whether it's virtual access to one's GP, telephonic access to a helpline, ICBT, which is interactive CBT, cognitive behavioral therapy, which we offer via Bupa as well. So it's all those new ways of dealing with mental health problems as we work towards a new working life and spending time with our families, for those of us who do have families. So I hope you've enjoyed sharing our time, myself and Hazel, around those clinical insights, drawing the links between mental health, physical health, and social well-being. And I'd like to pass you back now to Sarah. Say thank you very much.
Thank you very much indeed, John. And I think you really rightly bring out the fact that being confined during COVID has made us perhaps even more aware of what we value and what is important to us to sustain our own mental well-being. I'm going to invite everybody to come back on the screen now, Richard, Hazel and John, and we are going to have a bit of a discussion about some of the issues that you have exposed to us here. I'll start with a question to Hazel. Hazel, what suggestions do you have for CLA members to help separate home and work lives so that they can really sustain their mental well-being?
Yeah, I think it's a really, really good question. I think if you do have to work at home at the end of a long day, for example, I think make sure that you create a space in the home. So set up a designated area to complete that work and keep it away from areas where you would tend to relax. So, you know, the kitchen table, the lounge room, stay away from there. Once you're done with that work, put it away, put it out of sight. I think establishing a routine in the morning and evening is really important as well. So you can clearly switch on and off from work. So, you know, a coffee in the morning might signify to you that that's work starting. And then, I don't know, something as simple as a shower at the end of the day is signifying that work's ending. And after that, no more work is completed. And I think just the third thing is, you know, work-life balance. So there is no point in separating work and home life if you're going to be at work 23 out of the 24 hours a day. So I think it's something to be very conscious of.
Thank you. And how, just on a practical basis, the thing I find myself is, particularly now it's winter, it's so much harder to motivate myself to make those breaks and to get outside, which was the thing I was doing during the summer. How do you encourage people to cope with that?
Yeah, I think there's different ways that you can do it, and I think you need to find what works for you. So if I think of myself, particularly now that we're in winter, I'm the same. I find it really hard to find motivation. And so what I've done is to sign myself up to basically a community exercise group that I can go along to in the morning and join. And not only does that help me to be motivated and go out and find that break, but it also gives me a break in a sort of social sense. I get that social interaction, albeit socially distanced because of COVID. It could be as simple as well as if you know that there's going to be a phone call that you have to take, rather than taking that phone call sitting down, whether that to be a supplier or whatever, or a family member, rather than sitting, get out and walk, try and get out and get the fresh air, and that will give you those breaks during the day. So I think finding things that will work for you.
Great. Richard, you want to come?
Just to add to that, I think from the perspective of our business, I'm talking from, and we've made a vested interest in our staff to sort of say, look, you know, during these times, you must take that hour for your lunch. You know, it's dark in the morning, it's dark in the evening, you might not get a chance to get a bit of sunlight or daylight. So we're trying to, obviously you can't force people, but try to enforce on staff, say, look, take that hour, you know, go out for a walk. If there is a bit of sun, hopefully it will replenish. Because we're now in a world of meetings through Zoom, through Skype, all these technologies. So what we need to be able to do is take a break from that and try to get out if we can. Great,
thank you. And I would just add that the CLA, we have really encouraged people not to schedule any meetings between 1 o'clock and 2 o'clock, so that everybody has the chance to get out and doesn't get squeezed. John, I'd be really interested. We heard a little bit about the stigma and people trying to break the stigma, but what are Bupa doing to help reduce that stigma during this pandemic time?
Sure, thank you, Sarah. Unfortunately, of course, stigmas are still preventing many from seeking help. Our own research at Bupa shows that just 1 in 20 adults say they've spoken to a mental health professional about their symptoms, and many feel they can't even turn to their family and friends, despite us living in that modern era I was referring to earlier on. So there's a danger that while we're in this pandemic, the pressure to keep calm and carry on, or as Hazel was saying, you know, you'll be all right, that sort of attitude could prevent even more people from coming forward. So throughout the pandemic, Bupa has been encouraging people to reach out and to get help if they're experiencing symptoms of poor mental health. I'm a GP myself, but I also worked in the rural setting as a psychiatrist for a spell. And I feel that it's important for people to discuss their experiences in order to normalize conversations, that we demystify mental health, and just sort of have a mind to how somebody else might be thinking. A few words of kindness, and then maybe a signpost by a layperson, of course, or any of us, even a clinician like myself, can really help somebody out with their lives. So we found at Bupa that some people feel more comfortable discussing mental health issues remotely, as they can do so from the safety of home and with privacy as well, let's say on their smartphone. And hopefully a silver lining here is that it continues after the pandemic, that this all continues, and that the stigma around mental health care is reduced and people can seek help where they need it most.
Thank you. And so, assuming you can get over the stigma of talking about the fact that you might be struggling or broaching the subject with a co-worker, what sort of things are Bupa doing to then assist with mental health problems that might be arising during this time?
Sure. Thank you, Sarah. And well, Bupa has long recognised that mental health is just as important as physical health, as Hazel mentioned, and is committed to providing extensive mental health and wellbeing support to all of our customers. to our own people internally in the company and also the wider community. So we've invested in mental health services, including cover for more conditions, ongoing support for longer term conditions even, and that's happened in the last year and the last few years. So we've enhanced our Bupa from home services as well, and that offers customers advice from nurses on mental health concerns, fast access to diagnosis and treatment from our own GPs, including online, as well as our mental health therapists from the safety of home. So fast access is available through Bupa's mental health direct access service by telephone, which allows insurance customers to speak to a specialist without needing a GP referral first. That's really important, as fast access can improve the long-term prognosis of beginning to have those conversations early and sometimes beginning treatment early. So between March and September this year, 2020 that is, 90% of Bupa customers who needed to see a qualified mental health practitioner got an appointment within 48 hours. And to help families, Bupa has launched its family mental health line for health insurance members again, who are parents and guardians and are worried about a child's emotional well-being. So those members can phone and speak to a trained mental health advisor or mental health nurse. And Bupa has created also a free online mental health hub. And you'll see there mention of iCBT, Interactive CBT, full of practical resources, which is guidance and advice developed by mental health experts in responses to calls from our customers. So we have tools at Bupa for better emotional well-being, also tips for financial well-being to help us deal with everyday pressures as things move forward. Thank you, Sarah.
Thank you, John. Now, Hazel, obviously this pandemic has been going on now for best part of 3/4 of a year. And I wondered, can you tell us a little bit about the kinds of trends that you're starting to see in terms of the issues that are coming forward?
Yeah, definitely. I think one of the more positive trends that I've seen is that mental health and well-being, whilst they've always been a sort of talking point, or they've always been somewhere in the agenda, they've perhaps historically come second to other internal discussions or other discussions and priorities in their HR agenda. But I think since COVID has happened, mental health and well-being really now are at the forefront of most of these discussions. And people and organisations alike are much more open to starting to have these conversations. And I think that's a real positive. I think COVID created a huge amount of uncertainty, a huge amount of isolation, and a huge amount of financial pressure for a lot of people. That's probably the 3 key trends that I've seen. And I really think that has contributed to a rise in ill mental health, but I do believe that that's really opened the door to a positive new way of working and thinking about well-being and mental health.
Thank you. So the cliche that out of a crisis comes something positive in terms of an opportunity is also true here.
That's exactly right.
John, how about you? What sort of trends are you seeing?
Sure, Bupa has sort of seen that the pandemic has exacerbated the UK's need for mental health support, sort of increased it really. And many more people are struggling with those challenges that I mentioned, as has Hazel. So from our research at Bupa in June, we found that a staggering 8 out of 10 adults experienced poor mental health symptoms during lockdown and were delaying seeking help. This was particularly startling amongst the baby boomer generation, so-called, who planned to delay seeking help the longest, just over 2 months at 65 days. So I mentioned fast access before, which is what we do offer at Bupa. Fast access to treatment for conditions such as mental health can improve long-term prognosis. We're seeing high volumes of people now accessing treatment, which is important, and our forecasts indicate there will be a 50% increase in mental health claims as we finish 2020 compared to the same period last year. But we're accounting for that, of course. And Bupa's data confirms that much of this is being driven by high level of claims for anxiety and depressive disorders, acute stress, and indeed bereavement amongst adults and children. So COVID-19 has brought about a big change in the expansion of remote healthcare available and a surge in the numbers of people using it, I'm glad to say. And this is helping to remove barriers that might delay someone from seeking help, preventing longer term and more severe issues developing further down the line. So one of the few legacies of the pandemic, I feel, will be the wider and accepted use of remote services, and their use is set to accelerate, and their potential to make diagnosis that bit more swiftly. While let's be mindful as well, it is good to meet somebody in person and to speak to one's GP, one's healthcare professional, counsellor, etc. Thanks, Sarah.
Richard.
Just very quickly to add on top of that, I think it sort of expands on what Dr. John said there, and what I said earlier about the reinvention of healthcare delivery. So from a product perspective, certainly medical insurance, there has been a reinvention of healthcare delivery. All insurers, including Bupa, certainly for the forefront of that, have changed the way they interact with potential patients, and that bit about remote, about virtual consultations, that's been a big push since the pandemic, and a lot of insurers have had to adapt to that because obviously some levels of treatment weren't available through the COVID time. So a lot of the insurers have tried to do as much as they can through virtual consultations and having that conversation over the phone or via Skype, Zoom, etc.
So again, there's a positive message here, and one of the key things that anybody should be saying to a friend or a colleague is wherever you get your help and advice from, it is there, it is available. The resources are being ramped up, and you should definitely go and access it. Don't be afraid to do that, which is a really good and strong message. I had a specific question. I think I'll address it to Hazel initially. We've now got 2 trained mental health first aiders on the CLA staff team, and I've heard about mental health first aiding before. Is that something that it's worth thinking about having on your company payroll? How can you do that, and how does it benefit you?
Yeah, definitely. Thank you, Sarah. So I think anything that you can do that will encourage people to be more open and start to normalise the conversation around mental health, I think is a real positive. So I guess just thinking about what mental health first aiders are in the first instance. So mental health first aid is basically a training program that teaches members of the public or members of a company how they can support a person who might be experiencing poor mental health by signposting them to the relevant resources. The person basically undertakes a course that helps them to understand the range of mental health concerns that exist and the best way that they can, I guess, discuss this with somebody who might be seeking that support. So that would be, I guess, the only cost involved is the training. I will just say that, like traditional first aid, mental health first aid does not teach people to treat or diagnose mental health conditions. Instead, the training really does focus on teaching people how to offer initial support in that conversation and signpost them to professional services. And I think this is such a useful service to have because it basically gives people a set person that they know that they can go to who will have the answers at a time where they might be feeling really confused. So yeah, definitely beneficial.
I've also heard it's not for the faint-hearted, that it can be, emotionally taxing to do the training. That's what I've heard, but very worthwhile. Richard.
Yeah, again, just to add to that, I mean, I think it's gone one step further because there's now actually training the mental health trainer. So it's actually, you're exactly right. It can be stressful for themselves dealing with people who come to them about their problems, etc., and trying to cope with that. So there are services and training out there to actually support mental health first aiders as well as supporting mental health first aiders with support for staff. So there's lots of things going on. I think it will keep evolving as time progresses.
Thank you. Again, on the subject of practical things that people can do, I was reading, I think only yesterday, that the Army have decided to mandate annual mental health training or refreshers for all personnel. And I wondered whether that's the sort of approach that people should be thinking about. John, what do you think about that?
I think truly that's a great idea. So I think that, we've moved on from a time where, service personnel will be required to be robust at all times. Of course, we all perform in our lives as humans, and I think that needs to be recognised by our armed forces, etc. And it's a fantastic thing to have that annual check-in by people working in that sector, and then so that will come down to the chain of command, so to speak, to filter across and help people. And it's not just people at work in those armed services, of course, but it's also their families. Of course, GPs are available to those families as well, but at the same time, I think it's a fantastic idea there.
Thank you, John. Now, just to wrap up this part of the discussion, I'm going to ask each of you, what do you think is the main thing that CLA members should take away from this discussion to help improve mental health in their own rural setting, or rural company, rural family and community? So Richard, starting with you.
Yeah, I mean, first and foremost, I think what members need to be doing is potentially looking at what benefits they offer their staff, or what benefits have they got for their family, because there's a lot of support, a lot of helplines, employee assistance programs, mental health support that actually are delivered through some of those existing products. So I would certainly say it's worth reviewing and checking the existing benefits to make sure you've got that level of support within those products you already offer. I think Dr. John outlined earlier as well, businesses, they need to listen to their employees. What do their employees want? And hopefully there's a way that we can actually support members in providing the benefits that are required that will cover this area that keeps on growing.
Thanks, Richard. Hazel.
I think for me, my biggest takeaway would be thinking about what you can do to tackle stigma. I think each of our individual contributions do really help to drive change. And as that happens, we should see people being more open and seeking support within the industry where stigma has typically or historically been a problem. So I think, yeah, the takeaway would be just think about what you can do and challenge yourself to think about what you can do.
I shall certainly do that. And first of all, as we close the discussion, I just want to make you aware of some of these resources that are out there, whether that is your NHS resources or some of the voluntary organisations listed on this slide, whether that's the Samaritans, Mind, Yana, or You Are Not Alone, the Farming Community Network. They all have different things to offer, and we would really strongly encourage you to make use of them. I want to thank all of our panelists for what was a really great discussion. Thank you, Richard, Hazel and John, for sharing your insights with us. And lastly, to everybody who's listened in, thank you for joining us. I hope you found it helpful. And I think from all of us, we hope that you stay safe and well, both physically and mentally. Goodbye.